Good evening, everyone. And after the very nice sessions by Rashmi and Shalini, I am going back to theory. The urinary syndrome of menopause. It is. We all know that menopause is the most definitive event in the life of a woman, and it affects the quality of life. It is associated with 5 types of pelvic floor dysfunctions like dysfunction of micturition, defecation, sexual activity, there may be prolapse and pain. So what is the important fact? Important fact is that previously when we were studying, when we were in our PG days, we know it as vulvovaginal atrophy, atrophic vaginitis, but now since 2014, it is the term is coined as genitourinary syndrome of menopause, and the prevalence is around 25 to 50% after 4 to 5 years of menopause. But the thing is that only 25% of the patients seek the medical advice. And it is the fact that vaginal atrophy is progressive. We think it will recover, it will recover by itself, but it does not resolve at all. It requires treatment. So we can say genitourinary syndrome of menopause is defined as collection of signs and symptoms associated with decrease in estrogen and sex steroids, leading to changes in the lower genital tract and the lower urinary tract. Why we always say lower genital tract and lower urinary tract? It is because the lower part of female genital tract and the lower urinary tract arise from the common embryological origin. That's why the receptors are same in both these organs. They arise from the urogenital sinus, and both are sensitive to the effects of sex steroids and share common susceptibility to estrogen deprivation. That's why whatever changes we are having in the lower genital tract, we will have in the lower urinary tract also. And we all know with menopause there is lack of estrogen. Estrogen deprivation will lead to decrease in the receptors in the lower genital tract. There will be decreased density of estrogen receptors as well as androgen receptor and progesterone receptors. And this is the diagram. This is a table showing how the levels of estradiol, estrone, testosterone, and androstenedione level falls after menopause. We can see there is almost around 90% decrease in the hormonal levels in all these in the levels of all these hormones. What estrogen deficiency does? It will lead to thinning of epithelium, increase in the vaginal pH, changes in the vaginal flora, increased vulnerability to physical irritation, trauma. There is loss of vaginal rugosities due to breakdown of collagen support, and it does not appear immediately after menopause. It usually occurs 2 to 3 years after the menopause, and we can always go for PS examination to see the vagina, through which we can know the estrogen level in the body. So what happens actually with decrease in menopause, with decrease in the estrogen level at the time of menopause? Estrogen production reduces, it will lead to thinning of the epithelium. There will be less exfoliation of vaginal cells, less glycogen produced in the vagina, because these exfoliated cells are the food for lactic acid bacillus. Once the exfoliated cells are not available, there will be no action of lactic acid bacillus. So no glucose is produced, no lactic acid, no lactobacilli are working. So there will be no acid formation and the vaginal pH increase towards the alkaline side. It will lead to overgrowth of bacteria as well as there is decrease in the lactobacillus level. So what actually estrogen deficiency causes? It causes thinning of myometrium, decrease in the size of ovary. The vaginal lining becomes thin, dry. There is loss of vaginal rugosity, decreased vascularity of vagina, loss of vaginal elasticity, as well as shortening of vagina. At urethra level, what happens? There is relaxation of the bladder wall, the bladder wall relaxed, and the urethra becomes thinner. The muscularis layer between the outer layer and the inner layer becomes thin. And what happens in the vulval part? There will be labial thinning. The thickness of vulva, labia minora, majora reduces. There will be reduction in the hymenal tags, and as well as there will be reduce in the strength of pelvic floor. Symptoms of GSM, we all know there will be vaginal dryness, itchiness, burning, irritation, cracks over the perineum. Patient, or sometimes there may be vaginal spotting. Patient may complain of urgency, frequency of urination, urinary incontinence, dysuria, nocturia. There may be stress incontinence. And sexual symptoms like lack of lubrication, dyspareunia, decrease in the arousal, decreased libido, and many sexual dysfunction arises. But all these symptoms will affect the quality of life of a woman during this period. Diagnosis, we all know, it can be done by history, pelvic examination, signs that already we have discussed. We will see pale vagina with loss of vaginal rugosity, thin vaginal walls, narrowing of vagina, narrowing of introitus. Diagnosis can be done by wet mount microscopy, in which we can see the immature vaginal cells. By vaginal pH detection, a strip is available through which we can detect the pH of vagina, and we can go for modified vaginal health index. This is a vaginal health index in which we have to see the pH, moisture, rugosity, elasticity, length of vagina, thickness of vagina, epithelial integrity and vascularity, and through this we can go for numbering of the we can give numbers and then calculate the vaginal health index. So going for the management of GSM, we have to go for symptom relief as well as restoration of the urogenital physiology. I am not going in detail of checkup investigations. I am directly going to the duration of the treatment and follow-up. First of all, regarding the management of GSM, we have to go for local therapies. We avoid systemic therapies in such cases, and dose and duration we have to choose, and we have to individualize according to the patient requirement. And first follow-up will be required after 3 months of starting treatment. Second follow-up will be required after 6 months of treatment. And we can go for repeat testing, like we can go for vaginal maturation index after 6 months, TVS and mammography whenever required. First of all, we have to go for lifestyle changes. Maintenance of regular sexual activity is important for maintenance of vaginal health, because regular coital activity will provide increased blood flow to the vagina, and it will be helpful for the vaginal health. Even masturbation can be tried to increase the vascularity of vagina and the genital tract. If a woman is a smoker, then cessation of smoking is required to prevent vaginal atrophy. And regarding the management option, we have non-hormonal therapies like vaginal moisturizers, lubricants. Vaginal moisturizers, they provide immediate relief from the vaginal dryness and dyspareunia. But long term, we cannot use these things. They are actually hydrophilic bioadhesives, and they connect with the mucin in the epithelial cell and retain the water, and have buffering property which reduces the vaginal pH, from alkaline side to the acidic side. But these vaginal moisturizers and vaginal lubricants are less effective than the vaginal estrogen cream. We have two types of vaginal lubricants. They are usually used at the time of sexual intercourse to relieve from the vaginal dryness and dyspareunia and reduce the friction associated with the sexual activity. It can be water-based, silicone-based, but the disadvantage that it cannot give long-term therapeutic relief and may lead to irritation and infection later. And WHO recommends that lubricants should have the osmolarity less than 1200 millimoles per kg, otherwise they will cause infection and damage to the epithelium. These all preparations are freely available in the market. These are lubricating gel, Vagini, Lubic vaginal jelly, and I came to know that Zovintus has relaunched the pelvic gel, which is a lubricating gel. We have some companies have put Vagisil, that anti-itch cream. Usually these are the soothing agents which can be used at the time of intercourse and whenever there is irritation. But it is important to know that these temporary treatments like vaginal moisturizer and lubricants will not be helpful to be used in long-term basis. For long-term relief, we have to go for local estrogen therapy, which is the gold standard for the management of GSM. And it is important to note that local use of vaginal estrogen cream does not cause increase in the serum estrogen level. So we can use it even in patients with cancers, but it should be cautiously used in hormone-sensitive cancers. And it gives relief in around 25% of cases of urogenital atrophy. The various type of vaginal preparations are available, like estrogen cream, DHEA cream, intravaginal testosterone gel. Estrogen preparations are available in the form of estrogen tab gel creams. We can see the Femitest, Evalon cream. Devi gel is available, that is estrogen gel. And we can see the one dose in small packets. Estering, that estradiol vaginal rings, that has to be kept in the upper part of vagina and has to be changed according to the requirement of the patient. All these things, either vaginal tablet, vaginal gels, has to be applied through the applicator. And always the gel is better than the tablets, because the tablets get dried and stuck in the vagina. So it is always better to use gel as compared to tablets. Vaginal rings, they release daily dose of estradiol 7.5 microgram for 9 days. And it has to be inserted in the upper part of vagina, and it does not interfere with the coitus. But in various studies, it has been observed that either we use cream, tablet, pessary, ring, all appear to be equally effective and elevate the sign and symptoms of GSM. But we need to choose the things according to the patient profile, and we need to individualize the treatment according to the patient. Regarding the studies of vaginal estrogen cream in GSM, in WHI studies, they followed around 1,500 women and who used vaginal estrogen cream for a duration of 2 years. And in nurses' health studies, 900 women were followed and they used local vaginal estrogen for 3 years. But in no cases there is increased risk of, they have found that there was no case of elevated risk of endometrial cancer, breast cancer, colorectal cancer or CSD, stroke or DVT after the use of local estrogen, either in the form of tablet, cream, ring or anything. Also, phytoestrogen creams are also available, and they act slowly and they improve the VMI, that is vaginal health index, in around 90 days, but they are effective. Phytoestrogen, yeah, isoflavin gel we have in the form in the name of Isarin. DHEA gel is also available. DHEA is not orally active for GSM, but when we use in the gel form, it can be used for the management of GSM, and there will be significant improvement in the VMI score, decrease in the vaginal pH without significantly increasing the estrogen level. So now the practical part is, I was trying to get the pictures of or videos of application, but I am not able to get it. Just then I wrote the things. For application of vaginal cream or moisturizer, first of all, we have to get a private space. Then patient either has to lie down. First of all, we have to use a private space. Then we need to wash our hands. We need to squeeze the tube gently over the applicator. I think everyone of us have used have demonstrated the Evolon cream use in to our patients. We need to apply the applicator first and squeeze the tube in the applicator. Then after lying down, we need to keep the thighs apart and then gently insert the applicator inside the vagina till the comfortable level is reached. We cannot force we should not ask the patient to force it to a deeper level. Then slowly we need to press the plunger and then remove the plunger slowly. And after using the plunger, we can use the soapy solution to clean and then dry the applicator for further use. Helpful tips are, we have to use all the creams at bedtime to reduce the leakage and to improve the absorption. But a small amount of leak can happen. It can be reduced by using the panty liners. But it is a strict instruction that we should use the exact dose of the cream and exact duration which was prescribed by the doctors. Another thing which we should know how to use, because we need to explain our patients, are the vaginal dilators. These are the dilators of various size which are used to which have to be used in cases of vaginal atrophy, and there will be atrophy of the introitus also. So these are the vaginal dilators are silicone tubes of various sizes, and it is used gently to stretch the tissue and restore the elasticity. It helps to relieve the pelvic pain and dyspareunia associated with the sexual activity. And we usually prescribe the vaginal dilators along with the estrogen cream and the pelvic floor therapy. How vaginal dilators have to be used? First of all, we need to get a private space there so that the patient or anyone who is using can lie down. Or if the private space is not available, then even in a standing position it can be done. Wash your hands thoroughly before applying. Vaginal dilators, after taking the comfortable position, if the patient is lying, then you have to pull your thighs in the butterfly position to keep see the introitus. First of all, we need to apply lubricating jelly over the dilators and around the introitus, and then we need to push the dilators in the downward direction till that it is not causing the pain and irritation, and then we need to keep it for 10 to 15 minutes, and gradually then we will increase the size of the dilators. The angle of insertion is very important. It should be in the downward direction, and the duration of keeping the dilators is important. It is around 10 to 15 minutes. Then we can draw it, pull it back and draw again and push it. And after doing the rotating movement, we can use it 4 or 5 times in a day. And after 7 days, we can increase the size. So these are the actually very long lecture, but mainly it was the...
Dr. Sushma, I as a practitioner have very simple questions. Can you tell me the difference between a moisturizer and a lubricant?
A moisturizer is basically it is mainly to keep the vaginal mucosa moisturized. It can be
So
used...
can you tell a few examples, even one example? What is which is a moisturizer and which is a lubricant?
Vaginal moisturizer is pelvic gel, and these hydrating gels are there, and the lubric jelly is the jelly which we can use at the time of it.
Two different things, na? There is difference between a lubrication and moisturizing, and I am yet to understand the difference. That was, yeah, yes, Sonal.
Lubricant will help at the time of intercourse only.
Okay.
But moisturizer will help to maintain the moisture of vagina even without it.
Okay. Thank you so much. Thank you.
Rings are not available in India, but sometimes they are in Hyderabad. I have talked to a doctor, they are getting it online from somewhere else, but they are not available openly in the Indian market. Yes. Some drugs, they say Vagisil anti-itch cream. Actually, the content, if you see, it contains only steroid and some moisturizers, but the patients are using it because
See,
they are
the
getting
thing is,
comfortable.
you are not allowed to use steroid just like that.
We are not allowed, ma'am, but these things are Vagisil and are freely available in the market, and patients are using it. This is the lubricating gel, Vagini, Lubric gel, lubricating gel. These are all available in the market and freely available online.
Okay. So would you please conclude?
Regarding the lubricants, if you want, I can tell it in detail.
Conclude the session. I will find out and I will let you know. Everything is available.
The take-home message is, because many women do not discuss their problems with the doctor regarding the genitourinary syndrome. So it is very important to initiate the discussion with the patient regarding the vaginal health, whether they are having any sexual problems. If we find GSM early, we can treat it early, and we can prevent the negative impact on the life of a woman. And recurrence of attack of UTI and vaginitis should be taken care of, because mainly these are the cases of GSM which are actually not treated That's why they are having the repeated infections and vaginal infection and UTI.
She has a
So-
question.
Moisturizers are basically either water based or even hyaluronic acid based. They just
Maximum time.
moisturize the surface. A lubricant is an oil based one that actually glides on the surface. It is not absorbed into the glands or
Because they are
tissue.
like just to lubricate the thing at the time of
Yes.
intercourse.
Either oil
We
based
can
or
use
even they
it
can be
over
silicone
the
based.
dilators. You can use it at the time of intercourse.
Yes.
Lubricant has only this function.
Yes, it's a
Vaginal
sur-
moisturizer, but even vaginal moisturizer cannot be used for longer time because it will lead to infection. It will.
That is rare, but the purpose wise, that is
If
absorbed
you
into-
want to use vaginal moisturizer for a longer time, then it is better to go for estrogen cream rather than
correct. Yeah,
using the
that's correct.
vaginal moisturizer.
Yeah, what I wanted to impress is the function of each is different. That's all.
Thank you, ma'am. Thank you.
Okay, thank you.
Thank you, Sushma. So, with a very, very thin crowd and all our academic partners from pharma waiting for their certificates, I think it's time to
It's time.
conclude this workshop.
Thank you so
And,
much for patient
Thank
hearing.
you, Sushma. And there is a very, very thin attendance in this workshop. But those who are present, if you are able to implement one thing you learned every day for the next 7 days, I think we will call this workshop successful. So thank you so much for being here. Whatever you have heard, please try to implement. And now I would request our academic partners to please come forward and have a seat so that we can distribute the certificates. This conference would not have been possible without your cooperation. So I welcome all of you onto the dais. All the name you give it. आ जाओ. Jyoti, are you coming? Sushma? Sun Pharma? Requesting Sun Pharma? And Zuventus after this. These are our two major academic partners. Where's the moment? I want to thank Sun Pharma for being involved academically, but also taking charge of all the travel arrangements in the city. They have done a great job. Thank you, Mukesh. Thank you so much.
I really thank you all Sun Pharma people because ये एक बात है आपकी कि कोई भी काम अगर हम कुछ भी कहें चाहे छोटा बड़ा जैसा भी हो आपकी तरफ से हमेशा हाँ ही रहती है ये एक बहुत बड़ा सपोर्ट है थैंक यू सो मच
are always there for our help.
आपने हमारी लाइफ
Zuventus?
काफी इजी बनाई थैंक यू
Somebody from Zuventus, please come.
the second one of a very big support to the conference